Hello nurses and future nurses, welcome back to my YouTube channel, and on today's episode of Nurse Clement B, I am going to teach you how to serve bedpan to a helpless patient, not unconscious patient, to a helpless patient that is conscious. So sit back and watch this video till the end. Do not forget to like, share and subscribe to my YouTube channel at Nurse Clement B to keep you updated with nursing skills procedures, most especially to student nurses around the world. Keep watching my videos. It will help you during your OSCE examination. So as today, we are going to look at serving of bedpan, and I have my supplies. That's my requirements for this procedure. I have my tissue paper, I have my hand wash, and I have my towels, and I have my bath blankets, and of course at the bottom shelf I have my bedpan, and also I have my glove. So the first thing you will do as a nurse, as a student nurse during OSCE, of course you have to take permission from your patient, and you have to identify, is this the right patient? I'm going to perform this procedure. Of course you have to do that. So now follow me, let's go and identify my patient for this procedure. Hello, good morning. My name is Nurse Clement, and I'll be your nurse for today. Please can you tell me your name and your full name and your full date of birth? Okay, your date of birth?
9 January 2005.
All right, so I'll be your nurse for today, and I'm going to serve this bedpan to you, right? So please, can you cooperate with me so that you cannot move out of the bed to go and help yourself out. So that's why I'm here. And as you called my attention, of course I have to come and serve the bedpan.
Yes,
right? So of course I'm going to remove your trouser, after which I will give you this tissue paper to clean yourself, right? So let me go and get my supplies, that's my requirement, and I will get back to you, right? So after, when you are done with this, then you go and perform hand hygiene. Of course this is a clean procedure. You perform hand hygiene and then you don't glove, right? But the next thing is for you now to position this patient. Remember, this my patient cannot go out of the bed due to her disease condition, right? So now you have to remove this top sheet, right, away from the patient's body. Then you ask the patient from the shoulder this way, you assist the patient, lift the patient to your side, right, and also shift the patient to your side, and ask the patient to lift the patient's leg and then cross it this way, right? You are trying to prepare yourself to how to turn this patient to you to decide that which you want to place this bedpan, right? You can either use this underpart towel, or you can use this draw Macintosh, right? You can decide to use any of these two, right, to protect the bed linens on the bed. So I'm going to use this underpart towel to protect my patient, right? You have to prepare your underpart towel like this to protect the bed linens so that it will not get soiled, isn't it? So now you have to place this box, and I turn this patient this way. I ask the patient to place her, and I turn. Can you see the importance of flexing the leg now? The patient is right the other side, and I try to push the underpart towel under the patient's buttocks, and again I assist my patient to come back towards me, right, towards me, and I arrange the drop. Continue this way, and I assist my patient to place her legs straight, and I assist her back to the middle of the bed, and then back to the middle of the bed. The next thing is for me now to offer the patient the bedpan. So I pick up my bedpan, and if you're holding the bedpan, you hold it this way, right? You hold it by the handle. If you're using this, you hold it this way, and then you serve the bedpan to your patient. So again, I'm going to assist my patient to flex her leg this way, right? Then I will turn the patient this way, and I will not place it this way, rather you place it right, you place it under the patient buttocks using this edge, and you place it right. Then you ask the patient to come towards you, and then the next thing is for you now to elevate the head end of the bed, like placing the patient on 90 degrees, right, Fowler's position. I am elevating the head end of the bed of the patient to make the patient feel more comfortable on the bedpan, right? I'm placing the patient to 60 to 90 degrees Fowler's position so that the patient can be comfortable. And again, as you can see now, the patient is seated on the bedpan comfortably, and sometimes you can use extra pillow to support the patient's leg so that the patient will not get tired, right? So that the patient will not get tired. As you can see, are you comfortable? Are you okay in this position? Then you tell the patient, whenever you are done, I will just go for a while. When you are done, use the bell by your side, press it and call my attention, right? So that I can come and attend to you and clean you up. Is that okay? Now my patient has called my attention that she is done passing feces, right? So the next thing is for me now to remove this pillow that I use to support my patient, right? I will remove it from the patient's leg by lifting the patient and removing the pillow from the patient's leg. And again, I will bring down the head end of the bed, making it flat, right? Bring down the head end of the bed, and I'm ready to remove the bedpan, right? So I assist my patient, isn't that assist my patient, right? Flex her leg this way, and then I remove the bedpan, and I keep the bedpan, right? Then I give my patient tissue to clean herself. So you can clean yourself, right? So if the patient can, why not give the patient to clean herself? And if the patient cannot, you assist the patient. You assist the patient from up, right from the vagina, then to the anus, right? From up, down, right? This way, you ask the patient, you assist the patient up, down. But if the patient can, you give the patient the tissue, right? And you ask the patient to open her legs, and then she clean up herself by herself, right? After, when she is done, let's assume that she's done with cleaning herself, and she give me, I discard it inside the inside the bedpan, isn't it? So the next, to offer these patients water to wash her hands, and I offer her water in a bowl, and I ask my patient to wash her hand. So can you wash your hand, please? She wash her hand. You can even assist the patient, put liquid soap, let her wash her hand. You can assist the patient, right? Wash her hands, and right, she washed two of her hands. After washing her hands, then you assist the patient again to dry her hands. You give her hand towel to clean her hand properly, because to avoid contamination when she's eating. You assist the patient. If the patient can't, you assist the patient, right, to clean her hand properly, to dry her hand, isn't it? So after drying, you also discard it in a receiver. Then you turn the patient this way and remove. Remember, this can be done before washing hand and after the washing of hand of the patient. And you ask the patient to also turn your side, and also you discard this also in a hamper, right? You discard it in a hamper or inside a bucket, depending if it's soiled with fecal matter or urine mistakenly or any fluid. You discard it inside a bin for contaminated items, right? The next thing is for me to place my patient in a comfortable position, right? Place my patient in a comfortable position, making sure that she is fine, and tell her to call my attention whenever she needs me. I ask the, is it okay for you this way, or I bring it down this way? Which one do you prefer, this way? All right, then I ask my, since the patient wants the top sheet halfway her body, then I place it this way. I make her feel very comfortable. So thank you for cooperating with me. Thank you for staying with me till the end of this procedure. And after which, now you pick the fecal matter, right? You pick the fecal matter. You check for the color. The color, the form. Is the stool semi-formed, formed, or is watery? You check for the presence of blood, mucus, or parasites, right? Or worms, isn't it? You check for that, for the presence of those things. You check and the quantity. Then you go and discard inside the toilet. Make sure that you wash and what? Disinfect the bedpan, and then place it in a drawer inside within the toilet. When you are through with this, then you remove your glove, and then go and perform hand hygiene before you come and record. Remember, you have contaminated the glove, isn't it? So remove your glove, go and perform hand hygiene, and then come and record. So I'm done performing hand hygiene, so I have to dry my hand. The next step in this procedure is for you to record. Of course, you are done. You record what the time you serve the bedpan. Of course, the time you serve the bedpan, the color of the stool, remember, you have observed is it formed, semi-formed, or watery? Are there presence of parasites, blood, or mucus? You also record them, right? You record them in your record, and when you are done, you make sure that you sign that you are the one that did that perform the procedure, right? You sign, and then you keep. Is it on a paper or in a computer? Same thing. You indicate you are the one that did the procedure, isn't it? So thank you for staying with me till the end of this procedure. Thank you for watching my videos. Thank you very much. Bye bye.